Hello, healers, hello, warriors. Welcome back to the podcast. If you want to see a video version of this session, you can head over to our YouTube channel. I will put the link below in the show notes and you see all the links down there. I also have a link for you to grab to download our free hormone recipe ebook that will give you recipes so that you can start healing your body to start balancing those hormones. I am a firm believer that you don't have to wait for the pill. You don't have to wait for the herbs. You don't have to wait for anything. You can start balancing your hormones today in the convenience of your own kitchen. So I extracted a few recipes that I usually give to my patients that are experiencing hormonal imbalance symptoms, and I put them in a beautiful ebook for you. You'll see something for breakfast, you'll see something for lunch, there's something for dinner. So literally you have meals and shakes and smoothies and teas for a whole 7 days. Again, it is free. All you have to do is click the link below to download it, and then I give you instructions how to cook the food, and you just look at the food that is appealing to you, and then take the shopping list straight to your supermarket and get started. Now today we are gonna go through our second session of our hormone balance mini series. If you're new, you don't know what I'm talking about, I am hosting a hormone imbalance series to educate you on all things hormones, from the term hormonal imbalance to testing to the hormones you need to look at, and also to some tips and tricks and resources that you can implement or bring back to your doctor to help you navigate the whole hormone terrain. So I believe once you learn those things, you have them with you for the rest of your life. You can become an educated consumer. You'll be able to communicate with your doctor on a different level and verbalize your needs, your concerns, and your wishes to get the best care that is for you. So again, if you're viewing this video, you'll see me look down because I have notes. I don't want to miss anything. I want to give you the most basic, vital information that will serve you in the long run. So today we're going to be discussing the testing. Hormone panel testing. We're going to talk about 3 types of testing that I've seen out there. We're going to go to the advantage, disadvantages, and the accuracy of the test today. Now, patients will come to my clinic and they will tell me, Dr. J, I think my hormones are out of whack. That's what I hear often. And I will ask them, what do you mean? Remember from our last hormone imbalance session 1, we talked about how stating that your hormones are imbalanced is not enough. You have to be more specific, right? Because we have 60 plus hormones in our bodies and they are constantly changing. Hormone fluctuates day and night, and they travel throughout our bodies looking for receptor sites. And I believe, and I see this in my practice as well, that you cannot guess when it comes to balancing your hormones. You must test. And that is why we're going to talk about the 3 most common tests, the ones that you really need to ask for, that's going to give you the best results, that's going to help you identify the markers you need to focus on to balance your hormones. So it was shocking for me to learn that most people never got the hormone tested. Some of them are in their early 50s, late 60s, and they've never got the hormone tested. I often see patients on prescription hormonal medications, whether it's the pill, the patch, the IUD, pellet, hormonal products, without even half the hormones checked. And to me, that's dangerous, because if you don't check your hormones and you are taking hormonal products, you will put yourself at risk for overdosing yourself. And that's happening left and right. So then I will ask my patients that are coming in my clinic with those hormonal products, medications, a patch, a cream, pellets, whatever it is, I'll ask them, how do we know you are getting the right treatment or the right dosage? I will ask them, are we hoping and praying your symptoms will be addressed? Are you feeling better? And they will often tell me, Dr. J, I feel like crap. I don't feel better. I've been taking these hormones and I'm not seeing results. And 90% of the time, they will feel horrible. Or if they are seeing improvement, the improvement is short term. It's like very short lived, because the body recognizes the synthetic products that we are ingesting, we are putting into skin or under our skin in terms of pellets, or I insert it into a vagina, and the body start throwing in tantrum. We have to understand when we reach a certain age, you have to evaluate your hormones because they are part of your cellular makeup, and many people completely ignore this part of the health, right? They'll check everything else except for the hormones. And I know some practitioners out there do not believe in hormone testing. That is why you have to become an advocate for yourself to ask for the right testing. We cannot guess when it comes to hormone imbalance. Remember, sometimes you might have too much of this, too little of that. You have to evaluate your hormones. As I mentioned, they are part of your cellular makeup. You cannot completely ignore that. Sometimes you might have too much and too little. You have to be more specific on the hormones you need to balance and how aggressive you have to be with the treatment. Also, before you explore hormonal replacement therapy, meaning that feeding your body those exogenous hormones, like the hormones you get from products, because your body doesn't make it. When your body makes it, it's endogenous. When you get it outside, it is exogenous. You need to know the dosage so you can actually do not offset your body from producing the natural ones. If you have enough estrogen and then your doctor don't check your hormones and put you on estrogen products, you're gonna go into estrogen dominance. Your body will stop making the estrogen and then you find yourself having way too much. And sometimes when you check your hormone panel, when you do a hormone panel and you see the levels that needs to be balanced, most often you probably need a small dose, or you might need to detox, or you might need to supplement. So remember, hormones are needed for vital functions. They are needed for prevention, right? They are needed for our heart, our bones, memory, our skin, our sexual health. They are needed for moods. You need to check your hormones. Testing for hormone imbalance is crucial. We never guess. I see a lot of guessing going around, leading to people being sick and staying stuck and not getting the right results. And as I mentioned, I've seen many doctors who do not believe in hormone testing. So, what are the different tests out there? Let's discuss. But first, it is important to know that all tests will give you relevant information in terms of levels. However, when you look at them, it's like comparing orange to bananas to apples. When you look at all the testing out there, you are comparing orange to bananas to apples because they are not the same. Today we're going to discuss serum hormone testing, saliva hormone testing, and also urine. Again, they are not different. They are not the same. They are different. And we're also going to discuss the accuracy of each one. So hormones are produced by our glands, adipose tissue, and also different part of our bodies. And as a reminder, they are circulating in our bodies. They are looking for a carrier to bring them to receptor sites. So remember, if you don't check your hormones and you're receiving treatment, it's like you have a blindfold on and you're just trying to guess. You're touching things to see if that's the right thing for you. About 8 to 10% or 10 to 15% of our hormones are considered free hormones, meaning that they are biological active, meaning they are available to bind the receptor site. They are free. And this is the ones we need to check, the free one. Not the one that's already bound to receptor site. These are no good to us. We need to look at the free one to see the level of them. Remember that free hormones, biological active hormones. So the first thing we're going to talk about is the blood test. Let's get into it. As you can already imagine, blood testing is the most common one that is prescribed by many practitioners. It is widely available. You can test many things with the blood. You can, check your steroids. You can do thyroid hormone testing, your LH, FSH, estrogen, progesterone, testosterone, DHA. So, you can test a lot of markers with the serum tested. And it is easier for insurance to cover. So that is why most patients prefer that test. Serum testing measures the hormones that are already bound, the hormones that are already non-available, non-bioavailable. Remember, those are not the hormones we need to look at in order to balance our hormones. Serum testing, which is the liquid of the test, only detects the hormones in the liquid of the blood, not the hormones that are in the cells. These hormones are not available for the body to utilize, for your cells to utilize, for your tissue to absorb. It is not a reliable picture of how much hormones are available already for the body to use. Serum hormones testing does not allow the correct measurement of metabolites, which is how your body breaks down the hormones. That's what we call metabolites. We'll talk about that in a few, which can provide useful information to assist your doctor and also you in understanding your particular condition to help guide treatment options. Most of us do not love needles, so that's another disadvantage of serum hormone. And if you are not hydrated properly, you best believe when you go to your laboratory, they will be poking around. If you're on hormone replacement therapies like the cream, the transdermal patch, the pellet, so on and so forth, serum hormone testing is not a good indicator to see if the therapies are working, hormone replacement therapies are working. And that's why with serum, if you're looking at serum for testing, you will get overdose. I guarantee you. I see it happens all the time. Now let's talk about the advantages, disadvantages, and also accuracy. Advantages of serum is that it's widely available. All laboratories can do it. It is covered by insurance. It doesn't involve any much work from you. You just show up, right, to the laboratory, and then the phlebotomist will do the work. Disadvantages is like, again, you go to the clinic. Sometimes it's not convenient, although it's an disadvantage. The blood serum testing can be expensive because some insurance might not cover, or you might have to have a copay. You might have to give money if the insurance only cover a portion of it. So over time, as you are monitoring your hormone treatments, because you have to do multiple testing, that can add up. So that's why it is sometimes can be more expensive than saliva and urine testing. Drawing blood requires needles. Some of us are needle phobic out there, can be uncomfortable, can be distressing for some people. If you are not hydrated properly, the phlebotomist will be poking around. We don't want to do that. Some medications can interfere with hormones level in the blood. That's another disadvantage of serum hormone testing. Accuracy, it is very misleading, right? Results in which hormone levels appear to normal. How often do you go to your doctor, you do a blood test, and everything comes back normal? When in fact, there are imbalances taking place. It so happens it's not showing up in the blood test. It does not show how much hormones that is free for the body to use. So to me, serum hormonal testing is not the one you need to look at. It's never the one you need to look at. Not accurate, so many disadvantages, and you cannot extract the right results from that. Hopefully you can understand what I'm talking about. So if you go to your doctor and they are prescribing to check your hormones and they are prescribing blood tests, please, if that's what you choose to do for whatever reason, please know that you will not get the right answers or results by doing serum. Now let's talk about the second type of hormone testing you should know about, so to evaluate to see if it's the best fit for you. So the second one is urine testing, metabolites. It is a collection of urine over a period of 24 hours where hormones are secreted at night and during deep sleep, such as growth hormones. It is also a reflection of how the body metabolizes the hormone. So that's why we call it urine metabolites. So I use this in my practice if I want to monitor conversion and also to see if the issues that my patients are facing with are related to secretion or metabolism. So urine metabolite testing is a good fit. And I use this most often for patients that have a lot of flare-ups like endometriosis or a lot of infections or pelvic pains or stuff like that. I use metabolites because with the urine metabolites, you can extract certain things that you cannot extract with serum or saliva. So urine tests for metabolites of sex hormones when hormones are broken down in the body. By analyzing the metabolites, I'm able to assess hormone levels and their fluctuation in long period of time. With urine, you can also test for BPA, which is plastic, which is a toxins and environmental toxins that creates fake estrogen in our bodies, endocrine disruptors, making our bodies to believe that we are producing estrogen when in fact we're not. And that's how most of us will go into estrogen dominance, PCOS, endometriosis, fibroids. And with urine metabolites, you can also test your androgen hormones like DHEA. You can also test melatonin because if we go back and look at hormonal imbalance symptoms, sometimes sleep difficulties is a thing. And we just put people on melatonin when in fact it might not be melatonin. It could be something else. It could be lack of progesterone or low level of progesterone. With urine metabolites, you can also assess kidney functions, we assess creatinine, and also cortisol. It gives you a cortisol that's like in the morning, afternoon, evening, and also total cortisol and cortisone. So you can get a lot of information with urine metabolites. Some of this you cannot test with saliva. As I mentioned, melatonin you cannot test with saliva, and also BPH you cannot test with saliva when it comes to hormones. So 24-hour urine test hormones results may be different in patients with kidneys and liver disease. So that's one of the disadvantages. Dehydration or excess fluid can also interfere with the results of the urine. So you have to put that in the back of your mind. So what are the advantages of urine metabolite testing for hormones? So it's non-invasive. You just provide urine 24 hours. It shows long-term hormone production. Remember, long-term hormone productions, measures many hormones and metabolites in one test, can be done at home, and you just mail it to the lab. So disadvantages of using urine metabolites. One, is not always covered by insurance, so we have to think about the cost of it. Diet, exercise, medicine, medications, and other factors can change the hormone level and metabolite excretions. So data might be difficult to interpret. Not all laboratories offers it. And another disadvantage is that most practitioners are not educated in interpreting the results, because again, you're going to get pages and pages of results, and you have to make sure you work with a practitioner that can actually help you identify what those results are. Now, accuracy. Again, it's somewhat accurate if you're looking for long-term hormones, but it's not accurate when it comes to rapid hormone changes long-term. Sample contamination or dilution may affect accuracy, so you have to make sure that you have to follow certain steps. And also improper urine collection, storage, transportation can also affect urine. So there's some good and there's also some bad when it comes to urine testing. So now the last one we're going to talk about is saliva testing, which is my favorite. So the reason why I like saliva testing, which you'll see, it is the least performed, because most often it is not covered by insurance, but it measures the amount of free active hormones. Remember that term, biologically active hormones, unbound hormones, the hormones that are looking for receptor sites, the ones that you really truly need to look at to see what the imbalance is, so you can get the proper treatment to balance those hormones. It determines the hormones levels that are ready to impact your bodies, the tissue, and your cells. Again, you can look at the ones that are present in abundance and also the excess or also deficient. Hormones in the bloodstreams that are not bound to protein are filtered through your salivary gland and enter the saliva. Now, the saliva hormone testing is non-invasive and stress-free, easy, very convenient. You just have to, provide sputum in a sterile tube, but it has to be done correctly, because remember, hormones are constantly fluctuating. You have to provide samples multiple times throughout the day to see the ups and downs of hormones, and also to establish an accurate baseline and measures changes in hormones throughout the day, which is something you do not do with serum. You don't go to the laboratory and provide multiple samples, otherwise that would be terrible. Anyways, you won't get the right results in. So with serum, we are missing the true reflection of what the hormones are doing at the present time in our bodies. Again, the free hormones. We can test steroid hormones with the saliva. We can test stress hormones. We can also test androgen hormone, DHEA. But with saliva, there are some restrictions. You cannot test thyroid hormones, so we need the blood. And you cannot test FSH, follicular stimulating hormones, or luteinizing hormones for those that are menstruating. So that's why we have to incorporate some blood tests for the ones that we cannot test. So, but I found this method, the saliva, to be very easy. It's, pain-free, it's convenient. And then the beautiful thing about saliva, you can see both the exogenous hormones, meaning hormones you're getting from your treatments, your products, the patches, the IUDs, your hormonal products, and also your endogenous hormones, meaning the hormones that your body is actually producing. So you can get both. Saliva as a better screen for also doping athletes. Like for those athletes that are doing, testosterone shots or doing growth hormones, now they started checking saliva for them to see, because that's against the law, right? You're not supposed to inject hormones for performance. So let's look at the advantages and disadvantages of saliva. So saliva, you can test cortisol hormones, estrogen, progesterone, testosterone, DHEA. You can also test melatonin as well with saliva. Advantages: it is a direct measure of active hormones. Saliva testing is not invasive compared to blood tests. It's not inconvenient. You just ship the kit to your house and then you just do it at the convenience of your house. It doesn't require needles or visit to the healthcare facility. You do it at home. Saliva testing is cheaper. It is cheaper because remember, when it comes to hormone imbalance, you have to do multiple tests. In my hormone and sex survival program, we test at the beginning of the program. We also test at the end of the program. And sometimes we have to test in the middle to see where we are in terms of dosing. We cannot guess when it comes to hormone testing. You cannot guess at all. Saliva testing is cheaper, so that's why I mentioned it is cheaper. It is, and also promotes personalized approach to medicine. So I can literally look at the levels and then personalize your treatment. I love that. Don't you love that, to get personalized treatments? Disadvantages: saliva testing is not widely accepted because, again, traditional medicine doesn't cover for it. Some patients doesn't want to forge that money, which is a big disadvantage. And sometimes, there's some preparation you have to do as well. You have to, if you are menstruating females, you have to look at when you're having your menstrual cycle. So we go over all that with our patients. Accuracy: every small changes in hormone levels can be detected using this method. Saliva testing is particularly effective for hormones present in low concentration, also the ones that are present in high concentration. That is why it is my method of choice. I love the saliva testing. So in our hormones and sex survival program, I often have multiple services or protocols in my practice, and I don't always include testing. However, for our hormone and sex survival program, testing is included. I include a kit that has both the saliva and also dry blood. Again, because I want to test your thyroid hormones, as well as your sex hormone, androgen hormones, and your stress hormones. So in our sex survival program, you also get a kit included, just for this reason. Because my goal is to help you feel better, quicker and faster. And my goal is not to guess, and it's not to overdose you. So that is why, instead of patients telling us, I cannot afford this, it is too much money for the testing, I literally include it into the program to kind of break this barrier, to close that gap. Because when one or more hormone levels are off, too high or too low, it can throw your whole body, it can put your whole body out of whack. And some hormones stay longer in your body, and some hormones stay, have shorter lifespan in your body. Like for estrogen can stay in your body for 90 days. So if you have enough estrogen and I don't test your hormones and I'm prescribing more hormones, guess what? Estrogen hormones, I will overdose you and your body will be out of whack. You'll have lower progesterone, less of the hormones because estrogen is becoming dominant in your body. So measuring your hormone levels will help you not only understanding your symptoms, but also the changes that you need to make in your health, in those markers. And it's specific, like you get to see what's happening and how to move forward. Whether you're suffering with heavy bleeding, menstrual cycles, PCOS, endometriosis, fibroids, or full-blown menopause, or experiencing symptoms, accurate testing is the best way. And you have to choose the right testing, because remember, not all testing are created equal. So if you testing with the wrong method and you are using the wrong treatment or supplementing with the wrong products, hormones will not be accurate, leading to an appropriate dose. And again, as I mentioned, there's like a huge overdose situation we're trying to prevent here. So again, we have 3 methods: serum, which is widely available, covered by insurance, not giving you accurate results; urine, which provides like pages of information. You have to have a practitioner that can help you interpret those urine tests and choose the markers and go by that to see how your body's metabolizing the urine, the metabolites, to prescribe the correct treatments. And also you have saliva, which I think is the best one. It's easier for the patients to understand. It's also easier for your practitioner, and it provides the right amount of information. when it comes to hormone imbalance, first you gotta test. Second, you gotta start low and you go slow. And then third is to focus on not overdosing on any of those hormones. As I mentioned before, balancing your hormones is an art. You gotta have the right tools, the right resources. You cannot guess, and you have to have the right testing. So this is what I have for you. All 3 hormone testing panels: the serum, urine, and saliva. As I mentioned in my Hormone and Sex Survival program, I give my patients a kit that has the saliva and also a little bit of dry blood. You just, you put some blood at home. It's done at home, very convenient. There's no needles sticking to your arm, just a little pinch, and then that's how I'm able to evaluate your thyroid hormones. Now, if you did not grab our hormone balancer recipes, I want you to do that right now. I want you to click the link below, download this right now, because you can start feeling better. You can start feeding your body the nutrients that it needs to balance your hormones by grabbing the hormone balancer recipes. You have nothing to lose. I want you to be empowered. Again, I don't want you to just literally hand over your health to a practitioner, even including myself. I want you to start the journey at home. And for me, as I'm going through perimenopause, I am literally balancing my hormones and decreasing some of these few symptoms that I have by eating healthy. Eating for your hormones is different than eating for other things. And with the hormone balancer recipe, you'll see that I have a tea that I want you to drink every morning. I have some shakes in there. I have some smoothies in there. I have something for breakfast if you don't do intermittent fasting. I also have lunch and I have dinner. Again, this recipes, it's free. You don't have to pay for it, and it can literally start changing your life if you're serious about it. So grab the link below. Again, if you are listening to this on the podcast, you want to see the video portion of this, please click the link. You can head over to our YouTube channel to see the video. I would love for you to share this podcast, this video, with all the people that you might find that might benefit from it. I will see you on our next hormone imbalance session next week. On Tuesday, we're going to talk about estrogen, progesterone, and PMS. There are 3 types of PMS. So we're going to go over the difference between the 3 types, and also the role of estrogen, the role of progesterone. And then hopefully you can understand, my job is for me to show you how many of the symptoms can be very vague, can be very general. So it is not to say if you have, hot flashes, this and this and that, it's strictly estrogen. It could be also estrogen dominance. Like I have a patient right now who has endometriosis. She does have hot flashes. She does have night sweats. When I did her hormonal testing, she had a lot of estrogen. So if I didn't test her hormones, I would have just guessed and just give her estrogen products, because according to the book, according to whatever, when you have these symptoms, it is low estrogen. No, you have to test. You have to test. And next week, we're going to talk about those powerful hormones and what you can do, what to look for, what symptoms you might be experiencing. But at the end of the day, testing is always, always necessary. So again, thank you for listening to this podcast. Thank you for watching the YouTube video. I can't wait to see you next week, Tuesday. And please share, subscribe, and also don't forget to grab your hormone balancer recipe. I'll see you on the next episode. Bye.